Good afternoon. I hope everybody is enjoying today so far. Today, I'm going to give an overview on community health assessment topics. I've participated in a few of them with a few different communities throughout Texas, and there seems to be kind of a general trend on the different topics that are covered in each assessment. And so I'm going to touch these 15 topics very briefly. This is not all inclusive. I've probably forgot a few. If you work in those areas, I do apologize. First, I'm going to talk about demography. We have a lot of potential different indicators, including the populations by gender, race, ethnicity, age, population migration, unemployment, household income, level of education, families with children under 18, poverty, marriages, divorces, and then also community investment reports. Those actually you can get from the Texas Department of Insurance. Other possible data sources are, of course, the 2010 U.S. Census, the Texas State Data Center, the American Community Survey, Texas Health Currents, Vital Statistics, and Texas Health Data. A number of these we will be walking you through later this afternoon with Chris. General health. There's a number of potential indicators for this and other data sources. You have the BRFSS with the fair or poor general health, poor mental health, poor physical health. You also have vital statistics data on births and overall mortality, healthcare coverage, CHIP, Medicaid, temporary assistance to needy families, SNAP, coming from the HHSC. And SNAP, for those who don't know, is the Supplemental Nutrition Assistance Program. Chronic conditions, something I know pretty well, seeing that the BRFSS covers a number of them. I've listed all these potential indicators, which you have morbidity data on, but you also can get mortality data on a number of them, preventable hospitalizations. There's also some other hospital discharge data and cancer registry information as well. And each of these actually, once you get the presentation, are links to the websites, so you're not trying to fumble around finding them. Just thought it would be helpful. Huh? There we go. Health behaviors. Again, BRFSS related, physical activity, fruit and vegetable consumption. And the last set can actually overlap in different categories. It can overlap either with health behaviors or under substance abuse with smokeless tobacco consumption, binge drinking, heavy drinking, drinking and driving. And then there's also a bunch of data from the Department of Public Safety with drinking and driving that you can pull. Preventive health, other indicators you can look at there is if people are getting their annual checkups, cancer screenings, dental visits, HIV testing, any policies that your community may have had created around either secondhand smoke or something else I might not be thinking about, and immunizations. Infectious diseases, you can look at diseases by county through the DSHS Infectious Disease Control Unit or the HIV STD program. Rabies, West Nile virus, whooping cough, I know those have been kind of on the radar in the public eye recently. You can also look at some mortality data when it comes to like pneumonia. Mental health. There's some admissions data for mental health and substance abuse services. There's also a link with the Texas Mental Health Transformation, which has a school-based behavioral health survey that might be of use for communities as well. Again, substance abuse, BRFSS covers a good number for adults on cigarette consumption, smokeless tobacco, binge drinking, heavy drinking, drinking and driving, also with the Department of Public Safety. Safety and injury, there's a good number of potential indicators here and a variety of different data sources, including the Department of Transportation, Vital Statistics, BRFSS, DPS, Environmental Epi and Injury Surveillance, Poison Center Network, Department of Family and Protective Services, Department of Insurance, and then also Department of Insurance Claims. Aging and disability. DADS actually has an Aging Well Community Assessment Toolkit, which I have provided the link in case anybody would like to provide. Yes? Yes. It was the very first, yeah, it was the very first link that Bobby had up. Yeah, and Chris is going to put up the link to it as well when we take a quick break between presentations, so everybody has his demo slides. So you can also do American Community Survey, has some disability status indicators. The BRFSS has disability questions. We actually have an expanded definition of disability starting in 2013. And then you can also do all indicators by age to look at that aging well population. Infant and child health, again, a variety of different data sources with vital statistics, the immunization branch for kids that are getting immunized, fitness assessment data from the governor's office. Texas Education Agency has a variety of data sources as well. Also, our DSHS school health program, which I don't think I have listed here. There's the Childhood Lead Poisoning Prevention Group. Admissions data for mental health and substance abuse services also has admissions data on children. There's Child Protective Services from DFPS. There's a variety of different data sources and indicators to think about. Maternal health. There are, again, a variety of indicators with births to mothers less than 17 years of age, reported pregnancies, births, fetal deaths, and abortions, onset of prenatal care within the first semester, educational status, family planning, most of them coming from either Vital Statistics or the BRFSS. Workforce. The Center for Health Statistics has a wide range of workforce data between nursing workforce and health professions resource center. We've monitored the public health workforce. We do supply and distribution of state licensed health professions. We look at shortage areas and medically underserved areas, and also the nursing workforce. Facilities. Again, there's the state mental health facilities in which you can look at facilities that provide mental health sources. We have a hospital survey unit within the Center for Health Statistics that looks at uncompensated care, beds and utilization, revenue from the hospital, types of hospital services that are offered at the hospital. You can pull these up actually on the website. We also have a licensing and regulation area at DSHS. And then there's a care pathways where you can actually look at licensed facilities for long-term care. Transportation sometimes gets left out of community health assessments, but we have fatal crashes and injuries, motor vehicle deaths. You can get data from the Department of Transportation, our vital statistics units, BRFSS, and then there's also a fatality analysis reporting system, which is a national system. And lastly, one of the biggest questions I get is how far can you drill down with these data sources? A lot of times you can actually drill down further than what you find on the website, and you really need to remember that. Sometimes it's regions, sometimes it's counties, sometimes it's zip codes, census tracts, but it really depends on the data source. Like I could tell you with the BRFSS, if there's enough sample size, we can do zip codes in counties and regions. But there's other areas, other data sources where you could even maybe do census tracts. So it varies by data source. Don't assume what's on the website is the only thing that you can get. Approach each program individually. And so with that, it's going to lead into Chris. I don't know if you want to hop over to the computer or...